In this tape, the first of two on the anatomy of the head and neck, we'll look first at the structures involved in support and movement of the head, then at the facial skeleton and base of the skull, then at the structures involved in breathing, eating, swallowing, and speaking. In the second tape, we'll look at the blood vessels of the head and neck, then at the brain, the cranial nerves, the ear, and the eye. As in other parts of the body, understanding the bones provides the foundation for everything else we need to learn. The skull is such a complicated piece of bony anatomy that we won't try to understand all of it at once. Instead, we'll build up our picture of it a little at a time in the course of this tape. In each section, we'll add the parts of the skull that are new to the parts that we've seen already. In that way, we'll end up with a complete picture. In this first section, we'll look at the way the head is attached to the body and how it moves. We'll start by looking at the bones that are involved, then we'll look at the joints and ligaments that connect them. After that, we'll look at the muscles that maintain the position of the head and cause it to move. The bones that are involved in support and movement of the head are the thoracic and cervical vertebrae, the upper ribs, the clavicles, and this part of the underside of the skull that's called the occiput. The skull consists of the cranium and the facial skeleton. The cranium is the bony container for the brain and the foundation for the facial skeleton. The cranium is made up of a number of originally separate bones. These lines of fusion, known as sutures, show where the bones are joined. The principal bones that form the cranium are the occipital bone behind and below, the parietal bone and temporal bone on each side, the sphenoid bone, and the frontal bone. The two bones of the cranium that we're concerned with at present are the occipital bone and the lower part of the adjoining temporal bone. To see the full extent of the occipital bone, we'll take the mandible out of the picture. The occipital bone extends all the way from here at the back to here underneath. The most striking feature of the occipital bone is this large opening, the foramen magnum, through which the spinal cord and its accompanying structures pass. The part of the occipital bone in front of the foramen magnum is called the basilar part, often referred to as the base of the occiput. The two temporal bones converge on it from each side. We'll look at them in a minute. Let's look at the occipital bone on the inside in a skull that's been divided in the midline. Here's the foramen magnum. Here's the basilar part of the occipital bone. It slopes forwards and upwards, more steeply on the inside than on the underside, since it's triangular in sagittal section. Let's look at some more details in a skull that hasn't been colored. On each side of the anterior half of the foramen magnum are the two occipital condyles. The occipital condyles are the joint surfaces which articulate with the atlas vertebra to form the atlanto-occipital joints. We'll look at these joints in a minute. The outline of the front and the top of the cranium is well known to us from our everyday observation of surface anatomy. It's perhaps surprising to see how far round the back of the cranium curves, and what an extensive overhang there is behind. The overhang is formed by the part of the occipital bone that's behind the foramen magnum, the squamous part. The overhang is obscured by the neck muscles that are attached to this broad area on the occipital bone. the bone bears the marks of their attachment. This lump in the middle is the external occipital protuberance. This faint ridge, leading out toward the mastoid process, is the superior nuchal line. Below it is the inferior nuchal line. We'll meet the structures that are attached here later in this section. Now that we've looked at the occipital bone, let's take a look at the temporal bone. It's quite a complicated bone. To see its full extent, we'll again remove the mandible. The temporal bone goes from here on the outside to here underneath. This is the petrous part of the temporal bone. This is the squamous part. A prominent feature of the temporal bone is this large projection, the mastoid process. As we'll see, it's the origin of some of the muscles that move the head, including the sternocleidomastoid. It's easy to feel the mastoid process here, behind and below the ear. While we're getting introduced to the temporal bone, we'll take a first look at some of its other important features, which we'll appreciate in later sections of these two tapes. We'll also meet some of the small openings through which important blood vessels, nerves, and other structures enter and leave the cranium. There are many of these openings. Here, we'll just look at the openings on the outside of the temporal and occipital bones. This is the zygomatic arch, formed largely by the temporal bone and partly by the adjoining zygomatic bone. Here on the underside of the root of the zygomatic arch, this complex curved surface articulates with the condyle of the mandible to form the temporomandibular joint. This is the external auditory meatus leading to the middle ear. This long, sharp projection is the styloid process. Just at the base of the styloid is the little stylomastoid foramen for the facial nerve. Medial to the styloid process are two major openings for blood vessels. The carotid canal passing forwards for the internal carotid artery, and the jugular foramen passing backwards for the internal jugular vein. Just above the occipital condyle is the hypoglossal canal for the hypoglossal nerve. Let's take a brief look at the occipital and temporal bones from the inside. Here's the squamous part of the occipital bone. Here's the basilar part. Here's the foramen magnum. Here's the squamous part of the temporal bone. Here's the petrous part, which contains the structures of the inner and middle ear. Here's the jugular foramen on the inside. This big groove behind it is for the sigmoid sinus, the main venous drainage channel for the brain. Below and medial to the jugular foramen is the hypoglossal canal. Above the jugular foramen is the internal auditory meatus for the vestibulocochlear and facial nerves. The carotid canal ends here at the foramen lacerum, as we'll see in the next section. Now we've looked at the part of the skull that we're concerned with in this section. We'll move on now to look at the bones below it. First, we'll look at the special features of the first two cervical vertebrae, the atlas and the axis. Then we'll look at the continuity of the cervical spine with the bones of the upper part of the trunk. Here's the atlas. Here's the axis. These two vertebrae are adapted to allow movement of the head. Forward flexion and extension of the head take place up here at the atlanto-occipital joints. Lateral flexion of the head takes place at these joints too. Rotation of the head, together with the atlas, happens here at the joints between the atlas and the axis, the atlanto-axial joints. Because of their special functions, the atlas and the axis differ in several ways from typical cervical vertebrae. As we've seen in Volume 3, a typical cervical vertebra has a body in front and a neural arch behind, enclosing the vertebral foramen. It has a spinous process behind with 2 tuberosities and a transverse process on each side, also with 2 tuberosities. On each side there are 2 articular surfaces, one above and one below, which form the intervertebral joints. The articular surfaces slope upward and forward. They're connected by this mass of bone, the articular pillar. Each vertebra is joined to its neighbors by an intervertebral disc in front and by 2 intervertebral joints behind, one on each side. Now let's look at ways in which the atlas and the axis are different. The atlas vertebra doesn't have a body. In front, it just has this narrow anterior arch, which matches the posterior arch. The 2 arches of the atlas, together with these 2 lateral masses, enclose an unusually large vertebral foramen. This part is occupied by the spinal cord, this part by the odontoid process of the axis, which we'll meet in a moment. The upper articular surfaces of the atlas are shaped like parts of the inside of a cup, to match the shape of the occipital condyles. The lower articular surfaces of the atlas are shaped like parts of the inside of a cone. Now let's look at the axis vertebra. The body of the axis is prolonged by this important projection, the odontoid process. In terms of development, the odontoid process represents the missing body of the atlas. In terms of function, it's the pivot around which the head, together with the atlas, rotates. The upper articular surfaces of the axis are placed well in front of the lower ones. The upper surfaces are in a straight line with the odontoid process. As rotation occurs between these surfaces and those of the atlas, the odontoid process stays in the middle. The odontoid process is surrounded in front and on each side by bone. It's held in place behind by a strong ligament, the transverse ligament of the atlas. The odontoid process is also held in place from above by 2 strong ligaments, the alar ligaments, which are attached here and here. We'll see these ligaments shortly. The odontoid process has 2 small articular surfaces, one behind for the transverse ligament and one in front for the anterior arch of the atlas. To see how these structures relate to the base of the skull, we'll take an inside look from behind at a specimen in which the neural arches and the back of the occipital bone have been removed. Here's the foramen magnum. Here's the inside of the basal part of the occipital bone. Here's the atlas. Here's the axis. Here's the odontoid process. Here are the atlanto-occipital joints and the atlanto-axial joints. Now that we've seen the atlas and the axis, we'll look at the bones below them that are involved in support and movement of the head. The lowest cervical vertebra, the 7th, articulates with the highest of the 12 thoracic vertebrae. The 2 first ribs slope downward and forward from the first thoracic vertebra. The costal cartilages of the first 2 ribs articulate here with the upper part of the sternum, the manubrium. The manubrium, the first ribs, and the body of the first thoracic vertebra form the margins of this opening, the superior thoracic aperture, through which many important structures pass. To complete our picture of the bones in this section, we'll add the clavicles and the scapulae. On each side, the clavicle articulates with the highest part of the manubrium to form the sternoclavicular joint. The sternocleidomastoid muscle is inserted here. The scapula is attached to the clavicle here, at the acromioclavicular joint. In addition, the scapula is held in place by powerful muscles, the highest of which, the trapezius, arises here on the skull and is inserted here. Now let's move on to look at the ligaments that connect the skull and the cervical vertebrae. Like ligaments elsewhere in the body, these structures hold the bones together, permit the bones to move in relation to one another, and set limits to their movements. We'll look first at the structures that permit movement between individual vertebrae, the intervertebral discs and the intervertebral joints. Then we'll look at three ligaments that run the length of the cervical spine, the nuchal ligament and the anterior and posterior longitudinal ligaments. Lastly, we'll look at the special ligaments around the odontoid process. Here's what the cervical spine looks like in the living body. Here are the spinous processes, the articular pillars, the transverse processes, and the vertebral bodies. The intervertebral joints are here. They're synovial joints. To get a better look at them, we'll make a cut through the articular pillars along this line. As with all synovial joints, each bony surface is covered by a layer of smooth articular cartilage. The space between the cartilages is filled with lubricating synovial fluid. The fluid is contained within a fibrous joint capsule, which permits movement. Between each vertebral body and its neighbor, there's an intervertebral disc. To see the discs, we'll make a cut in the midline. The discs are made of fibrocartilage that's attached firmly to the vertebra above and below. The fibrous joints formed by the discs permit only a little movement between the regular cervical vertebrae. The movements that can occur between these vertebrae are forward flexion, extension, and a twisting movement that's a combination of rotation and lateral flexion. In the intervals between the occiput, the atlas, and the axis, where so much movement occurs, there are no discs, only synovial joints. Now we'll look at the three ligaments that run the length of the cervical spine, starting with the nuchal ligament. Here's the nuchal ligament, also called the ligamentum nuchae. It's a sheet of strong fibrous tissue that extends from the spinous process of the first thoracic vertebra to the external occipital protuberance. The nuchal ligament limits forward flexion of the head and the cervical spine. It also serves as the attachment for some major muscles. Next, we'll go round to the front to see the anterior longitudinal ligament. This broad band is the anterior longitudinal ligament. It runs the whole length of the vertebral column, connecting the fronts of the vertebral bodies. It ends up here, at this tubercle on the arch of the atlas. The anterior longitudinal ligament is not as impressive in the neck as it is lower down. In the neck, the ligament that's impressive is the posterior longitudinal ligament, which runs down the backs of the vertebral bodies inside the vertebral canal. To see the posterior longitudinal ligament, we'll remove the arches of the vertebrae and also the back of the skull along this line. The spinal cord and the brain have been removed, together with the covering layer of dura. Here's the base of the occiput. Here's the foramen magnum. Here are the divided vertebral arches. This is the posterior longitudinal ligament. It's much broader and thicker here in the neck than it is lower down the spine. The highest part of this ligament goes by a different name. It's called the tectorial membrane. To get a different view of it, we'll look at a specimen that's been divided in the midline. Here's the foramen magnum. Here's the anterior arch of the atlas. Here's the odontoid process. Here's the tectorial membrane. It's attached to the base of the occiput and to the body of the axis. Continuing as the posterior longitudinal ligament, it's attached to the backs of the vertebral bodies all the way down the spine. Now we'll look at the ligaments which hold the odontoid process in place, making it the stable pivot round which rotation of the head occurs. We'll see the transverse ligament of the atlas, the cruciform ligament, which the transverse ligament is part of, and the alar ligaments. To see them, we'll go back to the previous rear view and remove the tectorial membrane. Directly beneath the tectorial membrane is this strong and important ligament, the transverse ligament of the atlas. The transverse ligament is attached on each side to these two tubercles on the atlas. The transverse ligament prevents the odontoid process from being displaced backwards. A slender ligament, the superior band, runs upward from the transverse ligament to the base of the occiput. Another one, the inferior band, runs downward to the body of the axis. These, along with the transverse ligament of the atlas, are referred to collectively as the cruciform ligament. We'll remove all of the cruciform ligament to see the odontoid process and the alar ligaments. Here's the odontoid process. Here are the massive alar ligaments. They pass from here on the odontoid process to here on the inside of the occipital condyles. The alar ligaments limit rotation of the head, especially in lateral flexion. Here's the side view again. Here's the tectorial membrane. Here in front of it is the divided transverse ligament of the atlas. It's quite an impressive structure. Lastly, we'll look at the ligaments that connect the vertebral arches. The arches of the regular cervical vertebrae are held together by strips of yellow fiber cartilage, known collectively as the ligamentum flavum. The arches of the axis and the atlas and the edges of the foramen magnum are held together by these loose and flexible sleeves of fibrous tissue, the atlanto-occipital and atlanto-axial ligaments. We've looked at a lot of anatomy already. Before we move on to look at the muscles, let's review what we've seen of the bones, joints and ligaments of this very fundamental part of the head and neck. Here's the occipital bone and the temporal bone. Here are the basal part and the squamous part of the occipital bone. The foramen magnum, the occipital condyles, the external occipital protuberance, the superior and inferior nuchal lines. On the temporal bone, here's the petrous part and the squamous part. Here are the mastoid process, the zygomatic arch, and the surface for the temporomandibular joint. Here's the external auditory meatus and the styloid process. The stylomastoid foramen, the carotid canal, the jugular foramen, and the hypoglossal canal. On a typical cervical vertebra, here's the body, the neural arch, the vertebral foramen, the spinous process, the transverse processes, the articular surfaces, and the articular pillar. On the atlas vertebra, here's the anterior arch, the posterior arch, and the lateral bodies. On the axis vertebra, here's the odontoid process. Here are the intervertebral joints and the intervertebral discs. Here are the atlanto-occipital and atlantoaxial joints. Here's the nuchal ligament, the anterior longitudinal ligament, the posterior longitudinal ligament, and the tectorial membrane. Here's the cruciform ligament, consisting of the transverse ligament of the atlas, the superior band, and the inferior band. And here are the two alar ligaments. Now we'll look at the principal muscles of the neck. We'll build up our picture from the inside to the outside. We'll start with 4 short muscles on the underside of the occiput, the 2 oblique muscles and the 2 rectus muscles. Collectively, these are called the suboccipital muscles. Here are the 2 rectus capitis muscles, minor and major. Rectus capitis minor goes from the middle of the posterior arch of the atlas to this area on the occiput. Rectus capitis major goes from the spinous process of the atlas to here on the occiput. Here are the 2 oblique or obliquus capitis muscles, the inferior and the much smaller superior. The inferior oblique goes from the spine of the axis vertebra to the transverse process of the atlas. The superior oblique goes from the transverse process of the atlas to here on the occiput. The action of the suboccipital muscles is to extend the head and to rotate it toward the same side. Next we'll go round to the front to see the longus muscles and the scalene muscles. Here are the longus muscles, longus cervicis here, merging with longus capitis higher up. Longus capitis arises from the base of the occiput and inserts on the transverse processes of C3, 4, and 5. Longus cervicis arises from the bodies of C1 to 4 and inserts on the bodies of the vertebrae from C5 all the way down to T4. Longus capitis and cervicis are weak flexors of the head and cervical spine. Next we'll add the 3 scalene muscles to the picture. The anterior scalene, middle scalene, and posterior scalene. They arise from the transverse processes of the lower 5 cervical vertebrae. The anterior scalene from the anterior tubercles, the middle and posterior scalene from the posterior tubercles. The anterior and middle scalene muscles insert on the first rib. The posterior scalene inserts on the first and second ribs. The scalene muscles are involved not in movements of the neck, but in elevating the upper ribs in deep inspiration. The scalene muscles have important relationships to the subclavian artery and the brachial plexus, shown in Volume 1 of this atlas. Now we'll add the clavicles and the scapulae to the picture and go round to the back again to look at 3 large muscles that shape the back of the neck, semispinalis, splenius, and trapezius. We'll add semispinalis to the picture first. Here's semispinalis. It arises by many tendons of origin from the articular processes of C4 to C7 and from the transverse processes of T1 to T6. Semispinalis runs almost vertically to insert here on the occiput, just behind the 2 rectus muscles. The action of semispinalis is to extend the head. In addition, when we're upright or leaning forward, the tonic action of semispinalis prevents gravity from flexing the head. Next we'll add splenius to the picture. Here's splenius. It's a broad strap of muscle which arises from the spinous processes of T3 to C7 and from the lower half of the nuchal ligament. Splenius passes upward and laterally to insert in the lateral half of the superior nuchal line and on the back of the mastoid process. Splenius assists in rotating the head toward the same side. This muscle beside splenius is levator scapulae, which is shown in volume 1 of this atlas. Lastly, we'll add trapezius to the picture. Here's trapezius. Trapezius is a large and complex muscle. As shown in volume 1, its lower part extends all the way down to T12. Here we're concerned only with its upper part. The upper part of trapezius arises from the medial part of the superior nuchal line and from the nuchal ligament. Its fibers fan out downward and laterally to insert on the spine of the scapula, the acromion, and the lateral third of the clavicle. The trapezius muscles largely define the shape and outline of the neck, both from behind, here are the two trapezius muscles, and from in front. This is trapezius again. Trapezius is thought of mainly as a shoulder muscle. Its upper part raises the scapula. In addition, when the scapula is held steady by the action of other muscles, trapezius acts in the same way as semispinalis, in extending the head and in keeping the head upright when we lean forward. The last muscle to add to our picture is the sternocleidomastoid. Here it is. It arises from here on the mastoid process and just behind it. The sternocleidomastoid muscle runs downwards, forwards, and medially to insert partly on the medial end of the clavicle and partly on the manubrium. Contraction of one sternocleidomastoid muscle produces rotation of the head toward the opposite side. Contraction of both sternocleidomastoids together produces flexion of the head and cervical spine. When we're leaning backwards, their tonic action prevents gravity from extending the head and neck. The tendons of insertion of the two sternocleidomastoid muscles, together with the medial ends of the clavicles, define this hollow in the lower part of the neck. Now we've seen the principal muscles that produce movements of the head and neck. Let's review the muscles that we've seen. Here's rectus capitis minor and major, and obliquus capitis inferior and superior. Here's longus capitis and longus cervicis. Here are the scalene muscles, anterior, middle, and posterior. Here's semispinalis, splenius, and trapezius. And here's the sternocleidomastoid. That brings us to the end of this section on support and movement of the head. In this section, we'll look at the bones of the facial skeleton and the part of the skull the facial skeleton is attached to, the base of the cranium. Understanding the bony anatomy of this region will give us a good foundation for understanding some large and important areas of the head and neck. We'll begin by taking an all-around look at the main bony features of the region. Then we'll look at the individual named bones that make up the facial skeleton and the base of the cranium. Lastly, we'll look at the openings in the base of the cranium which some important nerves and blood vessels pass through. The facial skeleton consists of a number of named bones. We'll look at them individually later in this section, but we'll start by looking at the main overall features of the facial skeleton. To simplify the picture, we'll remove the mandible. The cavity for the eye is called the orbital cavity. It's protected on the outside by the thickened orbital margin. The opening for the nose leads to the right and left nasal cavities, which are separated by the nasal septum. The upper jaw, or maxilla, bears the upper teeth. The prominence of the cheekbone leads back to this bony arch, the zygomatic arch. The deepening hollow here is the temporal fossa. It's enclosed by this ridge, the temporal line, by the lateral orbital margin, and by the zygomatic arch. The temporal fossa contains the large temporalis muscle. The temporal fossa is continuous with this deeper hollow, the infratemporal fossa. The walls of the infratemporal fossa are formed by this part of the base of the skull and by the posterior part of the maxilla. The infratemporal fossa contains the pterygoid muscles and also this part of the mandible, the coronoid process. On the underside of the skull, we come to structures that we've seen already. Here's the foramen magnum, the basilar part of the occipital bone, and the petrous part of the temporal bone. Two thin sheets of bone project down from the base of the skull behind the maxilla. They're the pterygoid plates, lateral and medial. Between the two medial pterygoid plates are the posterior openings of the nasal cavities, the posterior nares, or choanae. The hard palate forms the roof of the mouth and the floor of the nasal cavities. Here inside the nasal cavities are the conchae, or turbinate bones. We'll look inside the nasal cavity in the next section. The posterior nares open into the nasopharynx, which lies in the space between the medial pterygoid plates, the base of the occiput, and the anterior arch of the atlas vertebra. In a minute, we'll look at the individual named bones that form the facial skeleton. Before we do that, we need to take a look at some of the features of the inside of the skull. This special skull has been cut away at a series of levels that are just above the floor of the cranium. The way it's been cut reflects the fact that there are two big steps in the floor of the cranium, formed by the sphenoid ridges and the petrous temporal bones. These divide the floor of the cranial cavity into three parts: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. We saw the posterior cranial fossa in the previous section. In this section, we'll look at the main features of the anterior and middle cranial fossae. The bone that forms this upward bulge in the floor of the anterior fossa is the same bone that forms the roof of the orbit. This crest in the midline is called the crista galli. On either side of it is a depression, the base of which is formed by these small areas of thin perforated bone, the cribriform plates. The cribriform plate forms the very narrow roof of the nasal cavity. Here we can see it from below. The filaments of the olfactory nerve, which transmits the sense of smell, pass through the openings in the cribriform plate. This flat area behind the cribriform plates is the roof of a cavity that we'll see later, the sphenoid sinus. Now we'll move back to the middle cranial fossa. The bone that forms the side wall and floor of the middle cranial fossa also forms, on the outside of the skull, the wall of the temporal fossa and of the infratemporal fossa. We've seen that this is the roof of the orbit. The bone that forms the anterior wall of the middle temporal fossa also forms part of the orbit. It forms this posterior part of the lateral orbital wall. This complicated raised area in the middle is called the sella turcica. The main features of the sella turcica are this deep depression, the pituitary fossa for the pituitary gland, this shallow groove for the two optic nerves, and these four projections, the anterior and posterior clinoid processes. This sloping surface behind the posterior clinoid processes, the dorsum celli, is continuous with the base of the occiput. The floor of the middle cranial fossa is marked by numerous openings for nerves and blood vessels, which we'll come back to later in this section. Now that we've looked at the shape of the facial skeleton and the parts of the cranium that it's attached to, let's look at the individual facial bones and see how each of them contributes to the features that we've seen. We'll look at the 5 largest facial bones first. They're the frontal and zygomatic bones, the maxilla, the sphenoid bone, and the ethmoid bone. The frontal bone is a very large bone. The lower part of the frontal bone forms the beginning of the root of the nose, the upper part of the orbital margin, a small part of the temporal fossa, and a large part of the roof of the orbit. The frontal bone also forms most of the floor of the anterior cranial fossa. The part of the frontal bone near the midline is hollow. The hollow space is the frontal sinus, one of the paranasal sinuses, which we'll look at shortly. Next, we'll look at the zygomatic bone. The zygomatic bone forms the bony prominence of the cheek. It also forms the lower lateral part of the orbital margin and this part of the lateral orbital wall. The zygomatic bone extends backward to meet the zygomatic process of the temporal bone, forming the zygomatic arch. Now we'll move forward and look at the maxilla. Here's the maxilla. The right and left maxillae are joined together in the midline. On each side, the maxilla forms the lower medial part of the orbital margin and almost all of the floor of the orbit. The maxilla bears the upper teeth. On the underside, it forms much of the hard palate. The maxilla is hollow. It contains the largest of the paranasal sinuses, the maxillary sinus. To see the posterior part of the maxilla, we'll remove the zygomatic arch. Here's the back of the hollow part of the maxilla. Down here, the maxilla is joined to the bone behind it, the sphenoid bone. Apart from this attachment, the maxilla is separated from the sphenoid by this impressive cleft, which has a vertical part and a horizontal part. The vertical part of the cleft is called the pterygomaxillary fissure. The horizontal part of the cleft is called the inferior orbital fissure. The inferior orbital fissure, here it is from in front, separates the floor of the orbit, formed by the maxilla, from the lateral wall that's formed by the sphenoid. Now we'll move on to look at the sphenoid bone. The sphenoid bone is extremely complex. It extends all the way from one side of the skull to the other. The sphenoid bone forms important parts of the underside and outside of the skull, and it forms part of the orbit. The sphenoid bone also forms this large and complicated part of the floor of the cranium. Here's a sphenoid bone all by itself. The sphenoid bone has a central part, and on each side 3 major projections: the lesser wing, the greater wing, and the pterygoid process. The central part of the sphenoid includes the clinoid processes and the pituitary fossa. The central part of the sphenoid bone is hollow, as we'll see. The lesser wing, which is the highest part of the sphenoid bone, forms the sphenoid ridge, which separates the anterior and middle cranial fossae. The underside of the lesser wing forms this small but important part of the back of the orbit. The greater wing of the sphenoid forms the front wall and part of the floor of the middle cranial fossa. On the outside, the greater wing forms this part of the temporal and infratemporal fossae, and it also forms this large part of the lateral wall of the orbit. The greater wing and the lesser wing are joined here, but more medially they're separated by this triangular gap, the superior orbital fissure, which forms a large opening between the orbit and the inside of the cranium. Here's the superior orbital fissure from the inside. We'll get a better look at it in a minute. The pterygoid process of the sphenoid bone projects downward behind the maxilla. The pterygoid process includes the lateral and medial pterygoid plates, which are the attachments for some important muscles that we'll see later. This hollow between the pterygoid plates is the pterygoid fossa. This little hook is the pterygoid hamulus. It's a pulley, as we'll see later. The last bone on our list of large facial bones is another quite complicated bone, the ethmoid. The ethmoid bone is a little hard to understand at first because in the intact skull, most of it is hidden from view. The only parts of the ethmoid bone that we can readily see are this small part of the floor of the anterior cranial fossa, the two cribriform plates with the crista galli in between, and this part in the medial wall of each orbit. It'll be easier to understand the ethmoid bone when we look at the nasal cavity in the next section. Till then, we'll leave the ethmoid bone alone. There are three smaller facial bones that we'll look at briefly: the nasal, lacrimal, and palatine bones. This is the nasal bone. This is the lacrimal bone. The two thin nasal bones form just the upper part of the bridge of the nose. The structural supports for the projecting parts of the nose are made of cartilage, as we'll see later. The little lacrimal bone forms the most medial part of the inferior orbital margin. This opening between the lacrimal bone and the ethmoid bone is for the nasolacrimal duct, which takes tears from the corner of the eye to the nasal cavity. Last of all, we'll look at the palatine bone. Here's the lower part of it. On each side, the palatine bone forms the posterior part of the hard palate and part of the side wall of the nasal cavity. We'll get a better look at the palatine bone when we look at the nasal cavity. Now we'll move on to take a look at the openings in the floor of the anterior and middle cranial fossa that we saw earlier. We'll look at three openings that pass forwards, two openings that pass downwards, and one that, in spite of appearances, passes obliquely backwards. We'll start with the ones that pass forwards. This round opening just in front of the anterior clinoid process is the optic canal for the optic nerve. Lateral to it, this large triangular opening is the superior orbital fissure, which we've seen already. Numerous nerves and blood vessels pass through it into the orbit. Below and behind the medial end of the superior orbital fissure, this smaller round opening, the foramen rotundum, is for the maxillary branch of the trigeminal nerve. We'll put this pointer in the foramen rotundum and go round to the outside. Here's the superior orbital fissure again. Here, medial to it, is the optic canal. The foramen rotundum emerges not into the orbit, but into the pterygomaxillary fissure. The two openings that pass downward are the foramen ovale for the mandibular branch of the trigeminal nerve, and just behind and lateral to it, the foramen spinosum for the middle meningeal artery. To see where those two come out, we'll go round to the underside. Here's the foramen ovale, just behind the lateral pterygoid plate. Here's the foramen spinosum, just behind and lateral to the foramen ovale. The last opening to look at is this untidy-looking opening, the foramen lacerum, for the internal carotid artery. In a dry skull, the appearance of the foramen lacerum is quite misleading. It appears to pass straight down through the base of the skull, emerging here at the tip of the petrous temporal bone. In the living body, the apparent opening on the underside is filled in with dense cartilage and fibrous tissue, represented by this material. Fibrous tissue also fills in this ragged part of the internal bony opening. What's left of the foramen lacerum is a clean-cut opening through which the internal carotid artery emerges from its obliquely running bony tunnel, the carotid canal. The other end of the carotid canal, as we saw in the previous section, is back here, just medial to the styloid process. In front of the opening for the carotid canal, there's one further opening that we haven't seen yet, the opening for the auditory tube, also called the eustachian tube. The auditory tube passes backwards and laterally to emerge here in the middle ear. The auditory tube is longer than this. Medially, it's prolonged by a tube of cartilage, represented by this colored material. The auditory tube opens into the nasopharynx, as we'll see. We'll look at these openings again in the sections of these two tapes that deal with the blood vessels and cranial nerves. We've seen a lot of bony anatomy in this section. Let's review what we've seen of the anatomy of the facial bones and the base of the cranium. Here's the frontal bone, the zygomatic bone, the maxilla, the sphenoid bone, and the ethmoid bone. Here's the nasal bone, the lacrimal bone, and the palatine bone. Here's the orbital cavity, the orbital margin, and the opening for the nasolacrimal duct. Here's the zygomatic arch, the temporal line, the temporal fossa, and the infratemporal fossa. Here's the pterygomaxillary fissure and the inferior orbital fissure. On the sphenoid bone, here's the lesser wing, the greater wing, and the pterygoid plates, medial and lateral. Here's the pterygoid fossa. Here's the hamulus. On the inside, here's the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Here's the sphenoid ridge, the crista galli, and the cribriform plates. Here's the sella turcica, consisting of the anterior and posterior clinoid processes, the pituitary fossa, and the dorsum celli. Here's the optic canal, the superior orbital fissure, and the foramen rotundum. Here's the foramen ovale, the foramen spinosum, and the foramen lacerum. Here's the true opening of the carotid canal. Here's the opening for the auditory tube. Here's the cartilage of the auditory tube. That brings us to the end of this section on the bony anatomy of the facial skeleton and the base of the skull. In the next section, we'll move on to look at the upper part of the air passage. You'll recall that there's one important bone that we haven't yet understood, the ethmoid bone. We'll take a good look at it in the next section. In the next 3 sections, we'll look at the parts of the head and neck that are involved in 2 vital functions: breathing and eating and drinking. To get a preview of these major topics, we'll look at a specimen that's been divided in the midline. The passage for air and the passage for food and liquid begin separately at the nose and the mouth. Air passes backward through the nasal cavity and the nasopharynx. Food and liquid pass backward through the oral cavity. The 2 passages unite here. Air, food, and liquid all pass through this common passage, the oropharynx. The 2 passages separate again here, in the hypopharynx. Food and liquid pass backward into the esophagus on their way to the stomach. Air passes forward through the larynx and into the trachea on its way to the lungs. So, the lines of travel for air and for food and liquid cross over in the oropharynx. It's important that air on the one hand and food and liquid on the other hand don't pass upward or downward into the wrong passage. To take care of this, there are important mobile structures above and below the oropharynx that act as separators. These are the soft palate above and the epiglottis and vocal cords below. As we'll see in later sections of this tape, the structures that form the passages for air and for food and liquid are also involved in a further important function, the production of voice sounds. In this section, we'll look at the upper part of the air passage. We'll look at the external nose, the nasal cavities, the paranasal sinuses, and the nasopharynx. We'll start by looking at the bony structures that surround these spaces. The bony opening for the nose is called the piriform aperture. Inside it, there are 2 nasal cavities, a right and a left, separated in the midline by the nasal septum. To get a better look inside, we'll divide the skull in the frontal plane along this line. There's a lot to see here. Let's get ourselves oriented. Here's the hard palate. Here's the floor of the anterior cranial fossa. Here are the medial walls of the orbits. Here are the 2 nasal cavities. The septum dividing them is a little off-center, which is not unusual. The roof of each cavity, formed by the cribriform plate, is very narrow. The medial wall of each nasal cavity, formed by the septum, is smooth and featureless. So is the floor. By contrast, the lateral wall is marked by a number of features, most notably by these 3 delicate bony projections, the conchae, also known as the turbinate bones. This is the inferior concha, this is the middle concha, this is the much smaller superior concha. The 3 conchae partially divide the air passage into 3 parts: the inferior meatus, the middle meatus, and the superior meatus. Here's the back of the orbital cavity. Below it is the hollow space in the maxilla, the maxillary antrum, which we'll look at later. At about the level of the floor of the orbit, the nasal cavity becomes much narrower. The narrowing is caused by the presence of this collection of small hollow spaces, the ethmoid air cells. We'll see more of these in a minute. To see more of the septum and the nasal cavity, we'll look at it in a skull that's been divided just to the left of the midline. Here's the bony part of the nasal septum. It's formed by this part of the ethmoid bone, the perpendicular plate, and by this small bone that we haven't encountered up till now, the vomer. The lowest part of the septum is formed by the maxilla and by the palatine bone. Here's the divided left cribriform plate. This projection above it is something we've seen before. It's the crista galli. The frontal section we were looking at was divided here, just behind the crista galli. Now we'll remove the septum to get a good look at the lateral wall of the nasal cavity. The roof of the nasal cavity runs along this line, rising to its highest point along the length of the cribriform plate. Here are the conchae again, superior, middle, and inferior. There are several openings in the lateral wall of the nasal cavity. They're partly hidden by the conchae. We'll see them in a minute. The lateral wall of the nasal cavity is formed partly by the maxilla, partly by the ethmoid bone, and partly by the perpendicular part of the palatine bone. Further back, where the nasal cavity becomes the nasopharynx, the lateral wall is formed by the medial pterygoid plate. The large facial bones that surround the nasal cavity, the frontal bone, the maxilla, the sphenoid, and ethmoid bones, are hollow to a greater or lesser extent. The hollow spaces in these bones contain the paranasal sinuses, which in the healthy living body are filled with air. The paranasal sinuses all communicate with the nasal cavity. To see the sinus cavities, we'll look at a skull in which part of the bone that overlies each sinus has been removed. Here's the cavity for the right frontal sinus. There's a left one, too, on the other side of this partition. The frontal sinus extends upward behind the lower part of the forehead and also, to a variable extent, backwards between the roof of the orbit and the floor of the anterior cranial fossa. Here's the cavity for the right maxillary sinus, also known as the maxillary antrum. It extends backwards to the part of the maxilla that borders the pterygomaxillary fissure. It extends downwards almost to the root of the upper molar and premolar teeth. The medial wall of the maxillary sinus is also the lateral wall of the nasal cavity. Its roof forms a large part of the floor of the orbit. The sphenoid sinuses occupy the central part of the sphenoid bone. This opening has been made to show the right sphenoid sinus. To see it better, we'll look at the skull divided in the midline. Here's the right sphenoid sinus again. Above the sphenoid sinus is the floor of the anterior cranial fossa and the sella turcica. Behind it is the basilar part of the occipital bone. In front of it is the high part of the nasal cavity. Below it is the roof of the nasopharynx. Lastly, we'll come round to the front to look at the collection of small cavities that contain the ethmoid air cells, collectively referred to as the ethmoid sinus. These extend from just behind the nasolacrimal duct all the way back along the medial wall of the orbit. As we've seen already, the ethmoid air cells lie between the medial wall of the orbit and the lateral wall of the upper part of the nasal cavity. Before we go further, we need to catch up on something that we left unfinished in the previous section: understanding the ethmoid bone. We've encountered the various parts of the ethmoid bone, but till now we've put off seeing the whole of it. We'll do that now. Then we'll come back and look at the openings of the paranasal sinuses. The ethmoid bone is a fragile coalition of parts. The best way to see all of them is to go back to the skull that was divided in the frontal plane. All of this is the ethmoid bone. This part, the perpendicular plate of the ethmoid, forms a large part of the bony nasal septum. This upward projection is the beginning of the crista galli, which rises up in the floor of the anterior cranial fossa. On each side of the crista galli are the cribriform plates, which we've seen already from above and from below. The most lateral part of the ethmoid bone is this paper-thin layer, the lamina papyracea, which forms this part of the medial wall of the orbit. Between the lamina papyracea and the upper part of the nasal cavity are the ethmoid air cells, as we've seen. The superior and middle conchae are also parts of the ethmoid bone. The ethmoid bone is joined to the frontal bone above, the maxillae below, and the central part of the sphenoid bone behind. Now that we've seen the ethmoid bone, we'll return to the cavities for the paranasal sinuses and see how they connect with the nasal cavity. We'll look at the openings for the frontal and maxillary sinuses first. Here's the frontal sinus cavity. Here's the maxillary sinus cavity, seen through an artificial opening. The frontal and maxillary sinuses both open in this complex area beneath the middle concha, which we need to look at in more detail. In a dry skull, there are two large irregular openings from the nasal cavity into the maxillary sinus, separated by this flake of bone, the uncinate process. In the living body, all of this opening and much of this one are closed off by soft tissue. The real opening of the maxillary sinus is back here. If we look in from in front, we can see that the opening is quite high on the medial wall of the maxillary antrum. The frontal sinus opens into the nasal cavity by way of a narrow passage, the frontonasal duct. The frontonasal duct starts above the uncinate process and runs upward and forward to reach the frontal sinus. The frontal and maxillary sinuses open into the nasal cavity, not directly, but into a narrow side chamber located here, called the infundibulum. The infundibulum isn't apparent in a bony specimen. We'll see it when we look at the soft tissues. Now we'll look at the openings for the other sinuses. The sphenoid sinus opens into the nasal cavity here, above and behind the superior concha. The ethmoid air cells, which are up in this region, have several small openings into the nasal cavity. Some of these are behind the middle concha, some of them are below it. There are two more openings to see in the lateral wall of the nasal cavity. The opening for the nasolacrimal duct, or tear duct, and an opening for nerves and blood vessels, the sphenopalatine foramen. As we've seen, the bony passage for the nasolacrimal duct starts here. The nasolacrimal duct, which is quite short, passes downwards and backwards to open beneath the inferior concha. Here's its opening. The last opening to look at, the sphenopalatine foramen, is the inner end of a short tunnel for blood vessels and nerves to the nose and palate. On the inside, it opens near the back of the superior meatus. We'll go all the way round to the outside to see the other end of the sphenopalatine foramen, which is here, in the depths of the pterygomaxillary fissure. Now that we've seen the bony features of the nasal cavity, we'll move back and look at the bones that surround the nasopharynx. Here's the posterior opening of the nasal cavity, the choana, or posterior nares. Its lateral wall is formed by the medial pterygoid plate. The medial pterygoid plate ends below in the hamulus. This piece of colored material represents the cartilage of the auditory tube. The cartilage forms an incomplete tube, open on the underside. Close to the medial end of the cartilage is a group of openings in the base of the cranium that we've seen before from a different angle, the foramen ovale, foramen spinosum, the opening of the carotid canal, and the jugular foramen. The roof of the nasopharynx, formed by the underside of the sphenoid and the basal part of the occipital bone, slopes downward toward the foramen magnum. To complete our picture of the bones around the nasopharynx, we'll add the cervical vertebrae. Here's the anterior arch of the atlas, and here's the odontoid process of the axis. Now, let's review what we've seen of the bony structures that surround the upper part of the air passage.